Actor Christopher Reeves is paralyzed and cannot breathe on his own after he broke his neck in a riding accident. Reeves suffered multiple fractures to the top two vertebrae in the neck and injured his spinal cord. He was mainly known for playing the main role in the film Superman in 1978, and he died in 2004 from heart failure at the age of 52. Reeves will be taken as one example for people suffering from a spinal cord injury. Throughout this video, we will learn what the spinal cord is and what its functions are, and what the consequences of a spinal cord injury are. This will be then taken as the basis to investigate the question, what makes therapy of spinal cord injury difficult? Next to the brain, the spinal cord is part of the central nervous system. It's a bundle of nerve tissue that extends from the end of the brainstem. The vertebral column, also known as spine, protects and stabilizes the spinal cord. It consists of 33 individual bones called vertebrae. Spinal nerves emerge on either side of the spinal cord. Since the spinal cord is segmentally organized, the nerves belong to one of four groups. It starts with the cervical spine in the neck region, followed by the thoracic, lumbar, and sacral region. The spinal cord carries motor information from the brain to the body and sensory information from the body to the brain, and therefore builds an important pathway for information transmission. In addition to that, since brain signals are sent via the spinal cord, also autonomic functions like the regulation of the bladder, breathing, and heart rate are included. There are many different causes that can lead to a spinal cord injury. In general, a lesion can happen when the spinal cord is highly compressed, flexed, or bent. In Reeves' case, it was a riding accident, where he landed on his head and suffered multiple fractures of the top two vertebrae, so on a cervical level. There is a differentiation between primary and secondary injury. Primary injury refers to the spinal cord damage that happens directly due to the traumatic event. So, for example, fractured vertebral bodies can compress and directly damage the spinal cord at the respective level. Although it is not explicitly stated, this could have injured Reeves' spinal cord. The primary insult also initiates a cascade of secondary injury, causes further damage of the spinal cord even months after the primary injury. This includes inflammation or cell death. The accident left Reeves paralyzed from the neck downwards, and he couldn't breathe on his own anymore. Paralysis means that he lost his muscle functions below the level of injury. Since nerves are damaged, thus information transmission is hindered. This depiction shows which body parts are paralyzed when a certain spinal cord level is damaged. Since Reeves' spinal cord was damaged on the cervical level 1 and 2, the top left depiction refers to his case. Having an injury on the cervical level causes paralysis of all four extremities, called tetraplegia, and having a lesion on the lumbar level only affects the legs, but not the arms. Reeves wasn't able to breathe on his own anymore, since cervical damage on or above level 2 to 5 also affects the respiration. That's why Reeves needed support by a ventilator. Nonetheless, there is a differentiation between complete and incomplete spinal cord injury. Complete means that all sensory and motor functions below the level of injury are affected by the damage. This case is depicted here at the moment. Incomplete is this: not all nerves are injured. The patients might be able to move some body parts below the level of injury after some time and rehabilitation. White regions indicate that these regions aren't affected, and the brighter color, the more functions are preserved. This is the most common case. In a post on the webpage of the Christopher and Dana Reeve Foundation, it is written that the doctor took away any hope of improvement, assuring him that it was impossible to recover movement. This statement summarizes the problem of and motivation for research in the field of spinal cord injury pretty well. Unfortunately, up to this point, it is impossible to recover from spinal cord injury. But why? We differentiate central nervous system, including brain and spinal cord, from other nerves in our body, the peripheral nervous system. In the early 1980s, Aguayo and his colleague investigated how damaged CNS axons behave in different environments, and they observed that damaged CNS axons could regenerate and grow over long distances within PNS environment, but not in CNS environment. So it seems like the environment in the central nervous system holds inhibitory factors that impede axonal regeneration. From this point on, research focused on identifying the inhibitory factors of the CNS environment in order to find treatment for spinal cord injury. In the late 1980s, Martin Schwab and his colleague Körner, they isolated an inhibitory molecule from the myelin sheet of oligodendrocytes. Oligodendrocytes, they provide myelin sheets around axons that isolate the axon and increase propagation speed of electrical impulses. This molecule is known as no-go-A. After injury, the distal part of the axon degenerates. This is called Wallerian degeneration. This causes no-go-A to be released into the extracellular space. The binding to a specific receptor, NGR, activates the so-called Rho-A, that in turn activates Rho-associated protein kinase, short ROCK. ROCK is associated with leading to apoptosis and growth cone collapse. The growth cone is the growing part of a neuron. Thus, growth cone collapse means that the growth process is stopped. In addition, the binding also causes a rise in intracellular calcium concentration that also mediates the collapse of growth cones. Schwab and his colleague used no-go-A antibodies to interrupt the signaling cascade that leads to growth inhibition and cell death. The antibody EN1 showed satisfactory results in rats. It leads to axonal growth combined with functional recovery. Similar results were achieved in monkeys. Despite these promising results, no-go-A isn't the only fact that it makes up the inhibitory environment. That's why the role of no-go is only limited because of other environmental inhibitors. Another one is the Glial scar that is formed at the site of injury. It mainly consists of reactive astrocytes. It on one hand builds a physical barrier that impedes axonal growth. In addition to that, astrocytes also secrete a molecule called CSPGS that also inhibits axonal regrowth. Nonetheless, targeting the Glial scar turned out to be more difficult than initially expected due to its dual role. It not only inhibits regeneration, but also turned out to be protective, for example, by restricting the spread of inflammation. So, to finally summarize and come to a conclusion, we first of all saw that although no-go-A is one of the major inhibitors, there are many more factors in the CNS environment that are inhibitory. So, only targeting no-go-A won't give a satisfactory result, and that is what makes treatment so difficult. Hence, a lot of research still needs to be done to identify all the inhibitory factors. Furthermore, there are factors like the Glial scar that inherit a dual role that makes treatment difficult, since the protective parts shouldn't be destroyed by the treatment. That's why, up to this point, current treatment focuses on pain treatment, rehabilitation, and psychological support to help patients in their daily life.